Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, November 5th, 2021. We're starting back with our monthly community updates. Usually do them on Thursdays, but was getting in town back from meetings in Austin yesterday. So I want to go ahead and do them today and get started with the COVID numbers. For our going on our fourth week in a row, we're starting to continue to see that decline. And that's a breath of fresh air for all of us. And we saw it for 2 weeks, and then last week, and then this week, we're finally in 3 full weeks of a decline in COVID in this area. We're still watching it closely. We're watching around us as well, as some of the numbers and some of the areas are still continuing to go on divert because of COVID, because of staffing shortages. So we're not out of the woods yet, but we're definitely seeing some improvements that we just want to make sure we pass on. As you see from a Titus County and the Paris standpoint, we're now down in the 40s of COVID patients across all the region, from Sulphur Springs to Texarkana. ICU patients we're getting close to, or still below available beds. Got close a couple of days ago, but back down as well. So we're continuing to see that trend. Still not the ability to transfer to higher acuity patients like we used to. There's still some slowness in that, and there's some no vacancies in some hospitals still, but we're watching it closely, and it's still something we monitor. On a Tyler perspective, you can see their hospitalized patients for COVID have gone down over the last 2 weeks and getting in that 150 range, and the ICU patients are going down as well. And you'll see the same trend in Dallas from a total patients. And we follow Dallas, so we watch Dallas closely. We're about 2 weeks behind Dallas during the last 18 months. So we're watching that closely. You see their ICU beds staying about the same, but they've dropped about 60 or 70, not as much as the hospitalized patients, but we're looking at it closely. But from a Texas perspective, across the state of Texas, you're starting to see that decline consistent. When I talk to other CEOs, they're seeing it as well. So a little bit of fresh air right now. We're watching it closely, watching as flu season starting to come into play. I'm starting to see more of that. We're watching all this closely right now. From a booster perspective, I want to make sure everybody understands TRMC is giving the booster. I would encourage you to go to titusregional.com. At the top, we have our maroon bar about vaccine resources. Click on that and you go to vaccinateeasttexas.com and you can register to get your booster. I would encourage you to do it. There has been an increase over the last week and last 2 weeks of people getting their booster, and having that appointment will help you jump the line, make sure we have enough supply that day and we're thawing out enough doses as well. We do walk-ins, but we don't encourage just walking in without an appointment. So go to titusregional.com and you can get the booster. We do have Moderna and we do have Pfizer, so we do have both boosters available. So it's exciting as well. The other thing that's happened this week is the COVID vaccine has been approved now for pediatric patients from ages 5 to 11. TRMC is working closely with the pediatric clinic on how we will do this in Northeast Texas. We are scheduled to start giving these vaccines next Wednesday. I would encourage you to go to titusregional.com, our website, on Monday and Tuesday, and we'll start having links out there for the pediatric shots and where to go. We are going to partner with the pediatric clinic with this, so we can use some of their facilities in the right space to do it, and use our pharmacy and storage as well. So we're excited to partner with them. But please talk to your pediatrician over the next few days, work with them, and then go to our website and you'll be able to sign your child up for 5 to 11. It is the Pfizer vaccine, ages 5 to 11, and we'll start next Wednesday. But follow us online as we get that ready and finalize that one. But we did receive our shipments yesterday, so we're excited to launch that early next week. The other one that you're hearing a lot about right now is the COVID vaccine mandates. And really what I can tell you right now, it's going to affect healthcare and all versions of healthcare, not just hospitals and different pieces, but all versions of healthcare. It's also going to affect employers as well. We're working with legal councils and trade associations right now to understand the impact and understand how that's going to work in Northeast Texas, and to see how our hospital system can help our local employers and local healthcare facilities as well to meet some of these mandates and just understand that. So we still have a long way to go. We are talking to our team members to make sure they understand this is what we're being told by CMS as a condition of participation. And then OSHA is working with some employers. So more to come on that, but just wanted to let our community know that we are following it closely and working with the right players to make sure we'll be up to speed and ready to go for our community. And again, I just wanted to finish on the Vaccinate East Texas. Go to that website, and then also our main website, Titus Regional. You can click over there as well, but you can and register for your booster. And if you haven't got your booster, you can also sign up and get your first dose or second dose, or even your third shot if needed, if meet those conditions. What I want to do is, with COVID going down and continuing to go down, getting the opportunity to do a few more things and focus on some other areas. We're excited at what's going to be happening in 2022. It's hard to believe it's November. And I would tell you this is going to be our last before Thanksgiving, but I'm excited that we may have an opportunity to do it in a Facebook post next week. But last night we had the opportunity to an appreciation dinner. And it's our holiday dinner / just appreciation dinner. It's an opportunity that we did not have last year to do in person, but we were this year, for the hospital and the health system to say thank you to our doctors and our advanced healthcare practitioners. I say this all the time, regardless of who I talk to. Our community is blessed to have the physicians that we have in this community. And last night was an opportunity for us to say thank you. We appreciate the Glovers allowing us to use the Flight Museum, a little more open space, so we could just have a little thank you dinner there last night. A couple things that came out of that last night. Dr. Gerald Stagg celebrated this year 40 years. 40 years. At Titus Regional, serving pediatric for that many years, and the pediatric clinic, the practice that he opened and started with his friends and colleagues and continues to run today, has been such a success in Northeast Texas. But we had the opportunity last night just to celebrate his 40 years, and then other physicians as well on hitting some of their milestones, both last year and this year, as we got caught up. We also had the opportunity last night to say thank you to Dr. Will Hooks. Dr. Hooks has served as Chief of Staff for several years now here at Titus Regional, and more importantly, he's been our Chief of Staff through COVID for the last 18 months. And he's been an integral part of the success that we've had here in Northeast Texas through his leadership, mentorship of us, and working with us and collaborating with us. And last night, we had the opportunity to tell him thank you for his service. He'll continue to be Chief of Staff through the December board meeting, but Dr. Beauvais, General Surgeon here in town, will be taking the reins in January. But we had the opportunity last night to say thank you to Dr. Hooks, and for us to appreciate, to give our appreciation to him for his service to our community. A couple other things that we've had going on that I just want to share. Should be seeing a post on Facebook either today or on Monday with a podcast. We had the opportunity last week to sit down with Y'all-It-Takes, WFAA Channel 8 in Dallas. Their podcast came and spent about 30 minutes with us. And what I enjoyed about the podcast is the good discussion, and it's some of the challenges that are going on in rural communities. And one of the questions we were just asked is talking about the differences in rural and urban, not just Titus County, but across the whole United States. We were able to give our input and give our feedback on that. We felt it was a great interview, a good opportunity to talk to the new station and give them an input and just have them understand what COVID's been like. Some success stories that we've had, some great things that the physicians and nurses have done in this community, but also the challenges that you have when you leave the city. So I just want to make sure they understand that and some of the things we fight the legislature on a daily basis. So that'll be coming out, but I encourage you, if you have driving somewhere, 30 minutes, but just take a listen to that podcast. I enjoyed doing it. I enjoyed sharing our story, and also had a friend of ours, John Henderson, with his Texas Organization of Rural Community Hospitals in Austin, who joined that podcast as well to talk about rural communities and healthcare. We also had the opportunity last Thursday night to have an appreciation dinner for our employees. And with the number of employees that we had it outside. And we also chose to have it on the windiest day of the year that I've seen in almost the 10 years that I've lived here, or 20 years I lived here in Mount Pleasant. Last Thursday, winds got up between 40 and 45 miles an hour. My wife was trying to put decorations out on tables in the parking lot, and glass was breaking everywhere. But it was a fun night, and it was only fitting that our appreciation dinner had the winds and just the cold air. But we appreciate the Scoggin band playing outside in the parking lot that night. It was nice just to sit back, have a nice dinner for friends, and say thank you to our team members for all their work that they've done over the last 18 months. So it was exciting to see that. We also, last Tuesday, it's been busy so far in the month of November, we did our bingo for bags, and appreciate everybody who came out that night. We had a limited number of tickets because it was inside this year with COVID precautions, but the fun was unbelievable. And I got a call at the last minute to help be the auditor in the crowd and check bingo cards. But raising this money was for purchases that will happen at the breast center across the street. It was a fun night, and I look forward to being able to do it again next year. I would encourage you if you didn't have the opportunity to go. But the ladies who attended this bingo for bags, it was a fun night and it was exciting just to watch them celebrate for a great cause. This will be our last official community update until December. So I want to wish everybody a happy Thanksgiving. I love Thanksgiving, not just because of great food and everything that goes around the holiday of eating food and watching football, but you also just appreciate Thanksgiving. And last year, up until this year, we've had a lot to be thankful for. So I'm appreciative of this opportunity, but just wanted to wish you and your family a happy Thanksgiving. And look forward to next week. Can't release it now, but I'm excited that we're finalizing some submissions and looking at some numbers and doing some calculations. But I do believe Titus Regional Medical Center is going to have an opportunity next week to make a huge announcement, something that we're very proud of, but we're excited we may have reached some milestones that we've been striving for. So look for that next Wednesday, Thursday, or Friday as we put that on Facebook Live, do a press release, but also probably jump on Facebook Live just to let the community know. So another thing that's going on that we're very proud of and just want to share with everybody here. So on behalf of the team at Titus Regional Medical Center, our board of managers and medical staff, just want to wish you and yours a happy Thanksgiving. Thank you for your support. God bless.